everyone, and welcome to CONNECTpreneur. I am Skylar Allison, the community manager for CONNECTpreneur, and we are happy to have you all here today. CONNECTpreneur is a global community of over 30,000 investors, CEOs, entrepreneurs, business leaders, and professional service providers from all around the world. 2025 marks our 14th year, and during this time, we've hosted over 100 in-person and virtual CONNECTpreneur forums with over 1,500 presentations from over 900 presenting companies and alumni. We've built an investor community of over 4,000 accredited private investors, angels, and family offices who have attended our events and who are interested in having awesome deals that they can meet through our platform. And our community database now exceeds 320,000 technology-based leaders and innovators from around the world. Hopefully you've been able to download today's program book. If not, no worries. We are going to have Emily Fanouche, our marketing coordinator. She's going to put that in the chat for you. So just be on the lookout for that link. We have an awesome list of 7 presenting companies today. After our final presenter, we will open up the breakout room, which will last for about 30 to 40 minutes. Each of our presenting companies hosts their own breakout room. I would just like to remind all the people on the call that time is for presenting companies to talk with investors. This is not a time for service providers or anyone else. It is just for the presenting companies and direct investors. You will be able to enter and leave whichever breakout room you would like throughout that 30 to 40 minutes. Another note is to please be respectful when using the group chat. Feel free to post your LinkedIn or contact info a couple times. Just make sure to not overload the chat. We would really appreciate that. We recommend that you download the chat transcript before breakout rooms and before breakout rooms end. To do that, you just click and open up your chat box and you'll see 3 little dots on the top right-hand corner, and you can click those and click Save Chat. We will be doing polling of our investors after every presenter today. I want to be clear that these polls are for direct investors only. These are not for service providers or anyone else. We ask only if you are a direct investor to answer these polls. If you are not a direct investor, you can just click out of the poll with the little red X in the top left corner. But please only answer these polls and respond to them if you are a direct investor. We go through these with a fine-tooth comb and make sure that we send only direct investors to our presenting companies. These polls are confidential, so we won't be sharing any of the results with the audience. Our marketing coordinator, Emily, is going to post some links in the chat for our YouTube channel, our in-person event coming up in June. We have a virtual event coming up in April, and as I mentioned, she'll post the link to today's program book. Lastly, if you are interested in sponsoring or presenting at any of our events, please feel free to send me an email. I'll put my email in the chat and I can get you all the information. Okay, so now we are going to put up our first poll, and our first poll is for our sponsors. So this poll is for everyone on the call. If you are interested in any of these services, please feel free to indicate that here. And while that is up, I am going to shout out our sponsors. We have Next, powered by Shulman Rogers, Modus Create, AEG, Prince William County Economic Development, Shulman Rogers, Northern Virginia Chamber of Commerce, Maryland Tech Council, Refraction, Startup Grind, Entrepreneurs Organization, Frederick Innovative Technology Center, Carrot Forum, Dingman Center Angels, Citrine Angels, MIT Alumni Angels, New Jersey Angels, Georgetown Entrepreneurship Initiative, Wharton DC Innovation Summit, Founder Institute, Ryan Wetmore, Enterprise Transformation Solutions, and Monty Jade Science and Technology Association. So like I said, feel free to answer that in the polling. So the next poll you see, though, will be for direct investors, as I mentioned. So please only answer the investor polls if you are a direct investor. Okay, with that, let's get started. To introduce our presenters today, I want to introduce longtime CONNECTpreneur partner, Sarah Klasper, who is an associate with Next, powered by Shulman Rogers, which is disrupting the way startup law is being performed with packaged offerings on a fixed price basis. Welcome, Sarah.
Thank you, Skylar. Thank you, Tien, Emily, and Avery, and the CONNECTpreneur team for today's great event. We are honored to be a longtime sponsor and supporter of CONNECTpreneur, which is a leading global event that connects entrepreneurs, investors, and everyone else in the startup ecosystem. A quick 3 points about Next. We are proud to be different and providing an innovative new model for providing legal services. We differentiate ourselves because we provide predictable and reasonable legal fees by putting things in fixed price packages. We still allow our clients to work with seasoned veteran attorneys in all areas that they need. And we also integrate robust technology platforms to allow the experience to be very transparent, collaborative, and efficient. If you'd like to hear more about Next, feel free to reach out to me after the program. Today, the first company I have the honor of introducing is All Clear Healthcare and the CEO, Bill Stone. Bill Stone has a career of exceptional results as a C-suite leader, a consultant, and an innovator. He and an extraordinary team created the All Clear Healthcare Lab during the pandemic when the community needed rapid, accurate, and affordable diagnostic testing. Now, solving for gaps in the healthcare system, All Clear Healthcare is modernizing gut health diagnostics through a simple, accurate, and affordable gut health breath test kit. I will let Bill Stone, CEO of All Clear Healthcare, tell you all about it.
Hello, I'm Bill Stone, CEO of All Clear Healthcare, where we are building the most trusted medical diagnostics technology platform for wellness and longevity. We all learned during COVID-19 that medical testing is broken. Long lines, slow results, underperforming accuracy, outdated technology. It was a mess. So we quickly launched a modern, customer-centric, and digital-centric testing company. With modest and consistent volumes, we generated 33% EBITDA, tested up to 1,000 tests daily, and partnered with some of the most respected brands, including Boston Consulting Group, F5, Institutional Investor, Harvard, etc. All this certified as a highly rated CLIA lab. Today, we're building a health diagnostics platform with gut health testing as our MVP, minimum viable product. Our platform might offer cheek swabs for early cancer detection, stem cell measurement to assess whether statins are degrading your immune system, or testing for Alzheimer's. Today, however, we're laser focused on gut health breath testing as our MVP. We are in market, generating revenue, and scaling gut health breath testing for chronic issues. Chronic gut health issues are life-interrupting. 1 in 4 Americans suffer digestive issues. 44 million are plagued with irritable bowel syndrome, IBS, a catch-all diagnosis. But without a precise diagnosis, chronic suffering goes on for years. Solving just 0.1% of IBS sufferers can capture $328 million in revenues. Our hydrogen methane breath tests are the new standard for gut health because they reveal the underlying cause of chronic gut health issues. The process is simple, highly accurate, affordable, and convenient. We are competitively outstripping the competition because we've built an innovative customer-centric and digital-centric platform for scale without legacy thinking or infrastructure. The manufacturer of our best-in-class diagnostic device has invested over $500,000, adding confidence that we can scale. We've built an extended sales channel of consultant coaches to medical practices. These consultants work with large numbers of practices who are committed to modernizing and advancing programmatic approaches to wellness. They have a proven ability to deliver outsized revenues to their client practices, and these consultants have described All Clear's gut health tests as a gateway to significant practice revenues. We have generated significant practitioner enthusiasm for our platform, tracking toward 500 practitioners aboard by year-end 26. We are focused on embedding gut health programs, delivering recurrent, programmatic, and predictable revenue streams. We are embedding our gut health programs in a way that is aligned with their larger, more extensive wellness programs, driving increased LTV, lifetime value for both the practice and All Clear. Expanding our wellness platform can add $125 million in revenues by 2030. LabCorp and Quest is $22 billion for testing meat and potatoes. Our experience with direct-to-consumer channels, practitioners, mail-in mother labs, and storefront testing facilities provides us with a solid foundation to scale once our gut health testing is ramped. Our scientific advisory committee has already defined a detailed wellness-focused portfolio of diagnostics, as well as the lab equipment, people, resources, sales, marketing support, space, compliance requirements, and so on.
Hello.
We have an extraordinary team with deep expertise clinically in the lab, on the books, operationally, and with our new executive chairman, Philip Thomas, who has run several medical diagnostics firms with lucrative exits, is the founder of Boston Business Group, chairs 4 Vistage groups, and with a background in naval intelligence and manufacturing, which includes gadgets for NSA and CIA, we are poised for profitable growth. We are raising $1 million to scale and meet demand. Together, let's do wellness and longevity diagnostics right. Please join us in the breakout room, and thank you, Opus 8 team and CONNECTpreneur team. Thanks very much.
Thank you, Bill. There should be a poll that will appear, an investor poll. Next today, we have Aquilius Ventures and the venture partner Cephas Sund. Cephas Sund has over 20 years of work in various fields, a JD and an MBA, all of which provide him with endless skills and knowledge to understand the legal and business aspects of startups and innovation. Aquilius Ventures focuses on early-stage health and environmental technology companies and actively supports them through strategic guidance, team development, and financial support. Please welcome Cephas Sund, venture partner of Aquilius Ventures.
Thank you, Sarah, and good morning, everyone. My name is Cephas Sund. I'm a venture partner with Aquilius Ventures. And to all the investors out there, this is one of the most challenging times in the investment industry due to the large number of competing products out there. What I'd like to talk to you about is the opportunity to invest in one of the greatest value propositions in the investment industry at the moment. Aquilius Ventures is a healthcare, medtech, and life sciences venture fund. And as it is a healthcare, medtech, and life sciences, it is often considered one of the most challenging due to the number of risks that come with those areas, those verticals. The reason why Aquilius Ventures is one of the greatest, if not the best value propositions out there right now in the investment world is because of our competitive advantage. Aquilius Ventures is formed in order to help startups in these verticals to overcome all these challenges that...
Cephas, just so you know, we don't see your slides advancing.
Yes, right. It hasn't. I haven't started advancing yet.
Okay,
yes.
great.
Thanks. Yes, so we help startups overcome these risks that are associated with these verticals. So Aquilius Ventures' story is actually over 20 years in the making. Leah and Mi-Feng, the GPs for Aquilius, met at the University of Florida while pursuing their PhDs. One of the biggest problems that they encountered was commercializing their research, which is often the case with healthcare, medtech, and life sciences. They might come up with some fantastic solutions, some fantastic cures, but getting those things to the market has been a big challenge. So, and then Leah began to pursue her MBA at Colorado University, where she began to see the possibilities that venture capital could bring to driving innovation. Leah and Mi-Feng began discussing how they could overcome this problem that they themselves had faced. And the first step that they did was to form Microtech. Microtech is a microelectronics engineering or manufacturing company. And with the success that they achieved with Microtech, they then took the next step of their journey, which was to form Aquilius. Aquilius is an innovation hub, but not just any innovation hub. There are many incubators and accelerators out there already, and it is very hard to differentiate between a lot of them. However, Aquilius's innovation hub is more than just a co-working space where startups can receive mentoring. With the innovation hub, there is a wet lab, there are clean rooms, there's a vivarium, And there is a tissue culture lab on top of the monthly programs that Aquilius Ventures puts together to connect not only the founders and the startups with investors, industry experts, and other individuals in the ecosystem. As mentioned, Microtech is a vital part of Aquilius Ventures. It is a standalone manufacturing facility, which is literally 5 minutes away from Aquilius. Microtech is dedicated to helping startups overcome the manufacturer hurdle. Not only are they manufacturing, but they are ISO 13485 certified, which helps them with more than just R&D, but actually overcoming the low volume manufacturing problem. With the successes that they've achieved already, Aquilius Ventures has attracted a deep team of compliance and technical talent to help startups overcome their challenges. So this is our competitive advantage. This three-pronged approach that Aquilius Ventures has brought is dedicated and ready to support startups, not only succeed and achieve success, but for the investors to help de-risk these startups in every step of the startup journey. Thank you, and hope to talk to you more about Aquilius Ventures and the things that we can do to help startups achieve success.
Thank you, Cephas. Everyone should have seen an investor poll up for that one, Aquilius Ventures. Next, we have Hopflight Inc. and Neil Winston, Chief Engineer. Neil Winston is an experienced flight test engineer with a career in the test and evaluation of advanced vertical takeoff and landing aircrafts. Hopflight is an aerospace startup developing that next generation dual-use electric and hybrid autonomous vertical takeoff and landing aircraft with the goal of creating a product line of passenger aircrafts for the emerging advanced air mobility market. Please welcome Neil Winston, Chief Engineer, who will tell you all about it.
Great, thank you for joining me today. Sorry, I had to unmute there. So here at Hopflight, we're ushering in a third revolution in aviation. So commercial aviation has not experienced a major technology disruption in decades. The market is full of large and complex aircraft that are expensive to operate and burn massive amounts of fuel. But in particular, I want to talk about helicopters. Helicopters are designed to carry multiple passengers and multi-thousand-pound payloads, but they're often asked to perform lightweight cargo missions. In the US Navy, 90% of critical shipboard repairs depend on the delivery of parts that weigh less than 50 pounds. The commercial offshore industry faces similar challenges, but to move this cargo, helicopters are the only option. The good news is that we have a solution. Hybrid electric vertical takeoff and landing aircraft will bring massive cost savings to critical logistics missions that are traditionally operated by helicopters. Burning less than 3 gallons an hour, Hopflight's uncrewed Cyclone UAS will cost less than $100 an hour to operate. This translates to 40 times cost savings and a 50 times reduction in CO2 emissions. Now, this is a totally new type of aircraft that combines electric propulsion with an onboard generator. This allows the aircraft to take off and land vertically, but fly over 500 miles. Our product line, the Hopflight family of aircraft, combines our patented technology and shared concepts to create a scalable product line of uncrewed and passenger aircraft. The Squall in the top right is a lightweight uncrewed aircraft for small payloads and flight science research. The Cyclone in the middle is a medium-weight uncrewed aircraft that uses a hybrid electric power plant to extend its range, bringing 100 pounds of cargo up to 500 miles. In the bottom left, our passenger aircraft concept, the Venturi, will carry 6 passengers up to 200 miles with a vertical takeoff and landing. Now, the advanced air mobility market has the potential to be bigger than artificial intelligence. Morgan Stanley is predicting a $1 trillion global market by 2040. In the US, the unmanned cargo market is expected to reach $30 billion by 2030. Now, in the near term, the majority of this market is in uncrewed cargo applications. So Hopflight stands out from competitors with our novel intellectual property. Many competitors use duplicate designs that are stacked with inefficiencies. Just take a look at the similarities between the 3 aircraft on the left. Those are all from 3 separate companies. Now, unlike competitors, Hopflight's entire aircraft is patent protected. The secret is our patented channel wing propulsion system. This novel method provides the aircraft with a distinct performance advantage and boosts efficiency. So due to our novel intellectual property, as I just described, we are already generating revenue through the licensing of our technology. We have $1.7 million in product orders for our small uncrewed aircraft, the Squall, that you can see on the right. We are also working to expand our technology licensing agreement to $25 million, covering the use of small uncrewed aircraft for government and defense use. We also have strategic partners in advanced manufacturing and hybrid electric systems. So our core team combines 100 years of aerospace design, manufacturing, flight test, and program management experience. We also bring on board members and advisors with experience ranging from executive leadership for Fortune 500 companies to admirals and generals. Development of the hybrid electric UAS is our priority to fill an immediate need in the market. This will be an 18-month developmental effort. We believe that with expanded production, we can sell 40 aircraft per year in 2029 and 2030, translating to $100 million in yearly revenue. So here at Hopflight, we're seeking investment towards our Series A raise to fill a demand in orders for our lightweight Squall aircraft and accelerate the development of the hybrid electric Cyclone. So thank you for joining me today, and I hope to see everyone in the breakout room.
The next investor poll should be up. Thank you so much, Neil. Our next company today is NeuroEM Therapeutics. Amanda Patinow has spent the last 15 plus years building startups and guiding organizations to growth and profitability by creating value in new and unexpected ways. NeuroEM is creating a first-of-its-kind device for safe, effective, and non-invasive approaches to treating neurodegenerative diseases such as Alzheimer's and protecting brain health throughout the aging process. Please welcome Amanda Patinow, Chief Product and Marketing Officer of NeuroEM.
Thank you so much, Sarah. So as the Chief Marketing and Product Officer here, it's my job to connect science and stories, and that's exactly what I hope to do with you here today. But first, who is this company that's claiming to stop and reverse Alzheimer's and without drugs? Well, if you haven't heard of us yet, you're going to. But for now, I'll fast forward through the 10 plus years of research, the NIH grants, the 9 granted US patents, about how we received the first FDA breakthrough device status for treating Alzheimer's, and how we recently earned a spot on the Startup Health Alzheimer's Moonshot community. But suffice it to say, we have an incredible team making incredible traction towards transforming this groundbreaking research into a commercially viable reality. So back to the story part. This is a story about Marty. When Marty was 83 years old, she was diagnosed with early stage Alzheimer's. And she's not alone. In the time that I'll be speaking with you today, the very, very brief time, 5 more people will have been diagnosed with Alzheimer's just here in the United States. And for Marty and the 7 million other Americans that are living with Alzheimer's, there's currently no effective cure or treatment available. At best, symptoms can be managed and the progression can be slowed down, but the drugs come with some pretty terrifying side effects and are very expensive. And the technology and devices that are out there so far just aren't effective yet. So without any treatment, it was expected that Marty, by the age of 89, would at best be in late stages of Alzheimer's, not able to make decisions, disoriented place and time, and unable to recall basic facts about herself and those she loves. Now, had Marty received the best antibody treatments or drugs on the market, she could have delayed that progression by several months, buying a little more time. Instead, her daughter enrolled her in our study, and this is what happened. Not only did our treatment stop Marty's cognitive decline, it actually reversed it. And a couple of months ago, maybe last month, very recently, Marty just celebrated her 91st birthday, and she was there to see her great-granddaughter be born on the same day as her birthday. And her most recent cognitive test scored within the normal range for healthy adults in their early 90s. Now, I promised science along with the story, so I wouldn't be here today if we didn't have some science to back this up. Our 8-person clinical trial showed the same significant impact that Marty experienced, and the Western Independent Review Board deemed our therapy to present no significant risk. And I promised you some science, not too much science, but what I will say is, we had an accidental discovery that led to a wearable cap using ultra high frequency pulses to break down toxic proteins and improve the key physical factors in the brain that are at the root of cognitive decline. And because we saw in the original data that not only the Alzheimer's mice improved after RF treatment, even the healthy mice performed stronger. So we have some universal application options across the cognitive wellness spectrum too. And in case any of you were wondering how big the market is, these statistics should tell you everything you need to know. The world is investing in the future of brain health beyond just Alzheimer's. So our plan is not to just keep raising tens of millions of dollars of research. We have a clear path to profitability, and that includes modest device sales goals that will become the economic engine that we'll use to fund our continued research and development for new applications of our technology. And of course, a plan is just a dream without the right team. And I'd say we've assembled a pretty great team of experts in their fields here. And right now, we're focusing on commercialization. So we're looking for mission-aligned investors who can help us take our device to market. If you're an early stage investor, we've opened our first institutional round by Blue Lake Ventures and are actively looking for investors. Now, I said this was a story about Marty, but really it's a story about time and the extra time that NeuroEM is able to give families of millions of Alzheimer's patients. Thank you.
Thank you very much, Amanda. There should have been an investor poll up for NeuroEM Therapeutics. Next today, we have Patternox, Ophir Aharon. Ophir has an impressive background as a previous inventor and chief technology officer of Skade Medical, and along with a PhD, he brings a wealth of technical knowledge and a proven track record of successful product development to his current role as CEO of Patternox. Patternox is disrupting the skin cancer market through innovating imaging to detect skin deformities for cosmetics and for skin cancer. Please welcome Ophir Aharon, CEO and inventor.
Hi, I'm Dr. Ophir. Do you really know what develops under your skin? How do you know if you don't look under? I was motivated by my mother's battle with skin cancer when I invented the scanner that can detect lesion deformities under the skin, a warning sign of skin cancer. As I say to my mom, I've got you under your skin. So we attract doctors, clinics, beauticians, home users, and of course, distributors. You see, the problem is that skin cancer detection relies on color at late stage, leading to a high mortality rate. And innocent lesions like these two can be lethal. Can you tell which one is cancer? How do you know if you don't look under? Our solution is PatScope, an innovative handheld scanner to detect deformities under the skin at early stage. We are the first in history to detect deformities as a precursor to skin cancer and cosmetic problems, including the information about the surrounding deformities for the first time. The scanner extracts light movement under the lesion surface. This is our unique technology. As demonstrated in the clinical trials here in Florida at the Skin Center. In addition, with our first of its kind AI, we can supply the level of the risk. According to the National Ambulatory Medical Care Survey, about 2 billion people, 2 billion suffer from skin deformities. In addition, 1 in 5 in US and 2 in 3 in Australia will develop skin cancer. The market is expected to grow significantly with forecast reaching minimum 30 billion by 2030. Our main competition is with digital dermoscopy, but they're mostly used for late stage. The others are just cumbersome method for the late stage and all rely on color. The founders is me, the inventor, and the CEO with international experience and one exit, it's important. Dr. Barry runs the clinical trials in Florida, Dr. Yuda strategy, Dr. Richard is surgeon, head and neck. Collectively, we have more than 150 years of experience. The business model generates 4 revenue centers. Revenue of $200 for each sale, and we can sell millions. Virtual meetings with our dermatologist, pay-per-use, and next step, insurance plan and reimbursement. And by the way, in the picture, this is us winning the first prize at the Shark Tank contest. Our main 3 markets are dermatologists and general practitioners, which mutually affect the market of beauticians and laser removals. And those 2 will mutually affect home user adoption. Revenue projection A24, 50 million for the next years after seed round, of course. Going global, the potential is stupendous. And we won 2 first prize also in AI and in the Shark Tank contest. The $1.5 million investment will bring the scanner to the world faster. A buyout by a large company or IPO is optional, but with our unique scanner and AI and virtual meeting and pay-per-use and reimbursement, we will dominate the market. Isn't it amazing to do it while saving life and making history? See you at the breakout room. We have a lot more coming. Thank you.
Thank you, Afir. You should see an investor poll for Patternox. Next today, we have SafeQual Health. Jeff has over 20 years of experience in scaling and transforming organizations in data-driven environments. He is passionate about building high-performance teams, fostering a culture of excellence, and delivering value to customers, partners, and shareholders. SafeQual has created a cloud-based enterprise software system for employee and patient safety and for overall improvement in healthcare delivery systems. Please welcome Jeff McWilliams, President of SafeQual.
Hello, everybody. My name is Jeff McWilliams, and we're SafeQual. We're based out of New York. We're a SaaS-based product servicing the healthcare system in the United States, providing enterprise-level software for patient safety, quality, and risk management. Medical errors are the 3rd leading cause of death in the United States. Some of the most common errors that you may be familiar with are medication errors, misdiagnosis, and falls. 1 out of 4 patients that enter a hospital experience some sort of event, and 1 out of every 13 have a preventable harm event. It's equivalent to 2 fully loaded Boeing airplanes crashing every day when you put it into perspective. So that's the problem we're tackling. CMS has chosen also to tackle this recently, issuing out a new set of measures called the patient safety structural measures that anybody in an acute setting has to follow. Thus, achieving this quality is very cumbersome and laborsome, which is why you need complex enterprise-level software. This is an established marketplace where almost all healthcare systems have a software system in place. What we're looking to do is make it more efficient and optimize that. And we've proven through ROI that we can reduce the amount of time that doctors and nurses spend on patient safety, quality, and risk. Bringing together all these departments across patient safety, compliance, as you can see on the screen here, requires automation, workflow, artificial intelligence, and the ability to bring these people together to make it bring efficiency so that we can prevent future harm from occurring. As you can see here, we have a serviceable market of 400 million today as part of a larger $2 billion TAM. And on the right side of the screen here, you can see our 5-year projections, which we can dive into deeper. We are an all-in-one system, SaaS offering, unlimited users that supports high reliability organization principles inside of U.S. healthcare systems. As you can see here on the screen, with the safety, quality, and risk product, we integrate with all the EMRs. The reason why we exist is that if you put it inside of the EMR, it becomes discoverable. And that is something that most healthcare systems are trying to avoid. When you look at the employee health and safety module, the reason we exist is that HR softwares cannot mix employee records with personnel records. So for that reason, we provide all this and integrate to provide a seamless experience. There are two main players that control almost 60% of the market share today, Datix and Simpler. We have successfully replaced both. They are vulnerable. In both cases, over 85% of their customer base are still on old legacy on-prem software. And given all the new regulations that are coming out and demands of today, there is an appetite for change, as seen by our over $11 million in pipeline today. As mentioned, $11 million in annual recurring revenue pipeline. Our ICP, or ideal client profile, is anybody with one hospital or more and over 1,000 employees. And we average a 4-year contract cycle there. We have a full go-to-market in place and are actively closing deals as we speak. We have a very robust 5-year forecast that we can dive into more detail in our breakout sessions or into further meetings. And we've assembled quite a great team that has experience servicing the enterprise market. And so with this team, we are ready to go servicing clients today. We are here to raise 3.7 million. Of that, we've already raised 1.8 at an 8 million pre-money valuation, and we're open to equity or convertible note. And some of the milestones is that we do have 9 live healthcare systems already, so we are not a beta software. We are post-beta. We have paying customers and over 400,000 in annual recurring revenue, with very attainable goals of reaching 2 million in annual recurring revenue by the end of the year, and profitability by middle of 2026. We hope that you will join us on our efforts, as there is a very strong rationale for investing and multiple exit opportunities in the next couple of years. Thank you.
Awesome. Thank you, Jeff. There should have been an investor poll that came up for you for Safe Qual Health. Next today, we have Space Phoenix Systems and Andrew Parlock, founder and CEO. Andrew is an experienced business development executive, leader, and strategist with unique experiences guiding businesses in domestic and international markets and across many industry verticals. Andrew has a deep passion for helping companies grow, prosper, and succeed. Space Phoenix Systems is essentially a space courier creating the FedEx for space. It is establishing a commercial service for companies and the government to allow Space Phoenix to manage their space missions. Please welcome Andrew Parlock, founder and CEO.
Good morning, everybody. I'd like to start, several people have started with a story. I'd like to start with a statement. And space as we know it, the business model is broken. We're forcing folks to develop bleeding edge technology, whether it be in med tech or biotech or advanced materials or semiconductors, and then getting them and then pushing them to build or buy their own satellites, build space operations. It's exceedingly difficult. We want to change that. And there's a reason we want to change it. The market is massive. World Economic Forum says 1.8 to 2.3 trillion dollars. NASA says $4 to $6 trillion by 2035. We are of that, about 500 billion to $1 trillion is dedicated to logistics. This is the market we're going after. And there's a problem here. It's constrained growth. Right? There's really a lack of cost-efficient round-trip services to space and back, and it's constraining the economy. Right? So there's very limited options. Right? Right now we have the Dragon. That's it. That's our up and back capability. There's one other company that's been successful. So very costly. And if you want to build and thrive in this market, you're really forced into this vertical integration model. Do it yourself. You have to build your own product. We want to change that. So our solution is we're developing the world's first fleet of reusable spacecraft optimized for rapid space cargo delivery and return. This is a concept changing the game here, paying only for what you need. Out of the gate, we're going to reduce the cost to space and back by 60%. NASA asked us just 2 weeks ago, when can we get to 100 missions per year? This is how much market pull there is. And we were not the only ones that NASA asked that question to. and changing the game with really an on-demand scheduling, really getting to what we do in normal business, moving that into the space business. So what's our value proposition? We want our customers to focus on what they do, whether that be advanced materials, med tech, biotech, climate tech, whatever it is that they need to use the perfect environment of space for, have them focus on that. And we manage everything else. At the beginning, we said a logistics provider, a third-party logistics provider. Think of us as a white glove service. You focus on your technology, we focus on everything else. These are our satellites. Again, we have a fleet concept. It's a new concept for the market. Hermes is our first one out the gate. Join me in the breakout room. There's lots of exciting things to talk about in these satellites. The most important on this slide is revenue per flight, which gets us to a very profitable stance by 2028. What's this market all about? This market's about biotech, med tech, climate tech, advanced materials. You pick it, the perfect environment of space can benefit that environment. Guys, the next industrial revolution happens in space, and we really want you all to join us because we're going to be supporting it and developing it. Momentum and market traction. We've already got a 300 million pipeline. That's with DoD and commercial opportunities. We're focused on commercial. 80% of our revenues over the next 5 years are commercial. So we're not limited to US government, but we are going to take advantage of it. 200 million in only 20 missions. Again, NASA's asked us, how do we get to 100? So we can imagine what the growth is from there. We've got line of sight on 1.5 million. We're looking to raise 7.5 million. So right now, today, we're really talking about an additional 6 million that can be done in equity, safe, or convertible notes. I'm trying to get to the end here. Our team, Tal is actually on the call with us, our CTO. He'll join us in the breakout room. And we really want you to join us on this journey. This is exciting stuff. And it's kind of the stuff that, if you ask me, that imaginations and dreams are made of. So join me in the breakout room. We've got a lot to talk about. Thank you.
Wonderful. Thank you, Andrew. And thank you, Sarah, for all the introductions. We have our final investor pull up right now for Space Phoenix. So feel free, if you are a direct investor, to answer that one. We are going to be opening up breakout rooms momentarily. Andrew, if you wouldn't mind taking down your screen, that would be awesome. No problem. Before we open up breakout rooms, I'm going to put up one final sponsor poll. So this poll that you're going to see now will be for everyone on the meeting. If you already answered it at the beginning of our meeting, no need to answer again. This is if you're interested in any of the services for our sponsors. Same question as the one at the beginning. So like I said, only if you arrived late, you can answer this poll. Okay, we are going to be opening up breakout rooms. These will last about 30 to 40 minutes or so. And they should be open now. You should see a button on the bottom of your screen saying breakout rooms. You can click that and click whichever company you would like to join. If you have any trouble getting into a breakout room, please just write the room that you would like to be in the chat, and I will help move you to that specific room. And we will see everyone in about 30 to 40 minutes and wrap up the meeting. So thank you everyone for joining, and we hope to see you at one of our upcoming events, which Emily will put the links in the chat for again. Thanks, everyone.